we have an interview with Mr. Jeremy Cornelius, a patient with sickle cell disease, a disease that many of you may have heard of. As we conduct this interview, you'll get to see what living with sickle cell is really like and how Cornelius has lived through it his entire life. Cornelius, it's great to meet you.
You as well. Thank you for having me.
Cornelius, tell us a little bit about yourself. What would you like our viewers to know about you?
Well, my name is Jeremy D. Cornelius. Born and raised in Flint, Michigan. 33 years old. Single, no kids, and I was diagnosed with sickle cell disease at the age of 2. Um, I am a licensed minister. I'm a saxophonist and a recording artist. I am a business owner. I'm an international model coach. I travel to train models and produce runway shows. And I do sign language and I'm a sickle cell advocate. Like, I do 1,000 things.
Amazing. What exactly is sickle cell disease?
Sickle cell disease is a blood disease that is contracted from the parents of parents either having the trait or the actual disease, passing it on to the child. And without using all of the technical terms, basically our blood cells are shaped like sickles or like crescent moons. And so it makes it very difficult for those cells to travel through our blood vessels and to carry oxygen through our blood into our vital organs. And so it is a chronic pain disease. And when we have those challenges where those cells aren't freely passing through those blood vessels, they're very sticky and they begin to clump up in those areas. And when those cells clump up, you begin to have pain, usually in the joints or the appendages areas that have the most movement. So like your arms, your legs, your knees, your elbows, things like that. That's pretty much it in layman's terms. It's treated through sometimes blood transfusions because we have a lot of times low hemoglobin. Our red blood cells break down a lot quicker than normal red blood cells, which causes us to be anemic. We have a lot of terrible pain. The change of weather, high altitudes, exertion, dehydration, um, cold weather, those things will affect us and cause us to go into what's called a sickle cell crisis or a pain crisis. It and ultimately it sucks. It just sucks and it's really whack.
Yeah. I actually did learn about this in school, like compared the difference between like how it affects you um mentally, physically, and yeah. So, how has this disease impacted you and your loved ones?
Well, I was actually just talking to one of my good friends yesterday actually, and I was telling him that you know I still have some scars, a little emotional scars, because growing up as a kid, I was always told to take it easy. You couldn't overexert yourself. You couldn't be outside for too long. You couldn't run. You couldn't play sports. Like, you couldn't do a lot of things. And that made it very challenging to grow up and try to have a reasonable, life, a reasonable childhood. And so growing up, it just really affected me greatly to where I really couldn't do a lot of the things that I was used to doing.
Right. Did you have any hobbies?
Yeah, growing up, well, um, I used to love track, and I used to love um, baseball, but I couldn't really play baseball or track because I would have a crisis if I did too much. And so, um, what I did was I got into band, concert band, and we just learned to. It was fun. That's the most that I could do. Uh, I couldn't really run or do a lot of things, so concert band was it. Playing the saxophone at the age of 9. I grew up in church, so I did join dance teams and different things like that. But I still had to be very careful and be limited in what I could do. And so in high school, I was able to march in a band, but also with that, after every field show, I would have a crisis. There were times where I spent birthdays. I spent my 16th birthday in the hospital. I spent my 18th birthday in the hospital. Had to have blood transfusions. I didn't have a lot of episodes growing up, but when I did have episodes, they were pretty bad.
Okay. Um, what do you think was the biggest challenge?
The biggest challenge, well, it's several things because one of the biggest challenges now that I'm older, um, I have a lot of complications now because I travel a lot, I work a lot, I do a lot, and so that caused me to have a lot of flare-ups. So I'm in some level of pain every single day, and that becomes difficult to deal with because I'm constantly hurting. I have to take daily pain meds. Excuse me, and I'm in the hospital a lot, so that can become very challenging because you don't know what your day is like. You literally, it makes it hard to plan a day. You go to bed feeling perfectly fine, and you wake up feeling as if a bus just fell on top of you, or you wake up feeling okay, and then halfway through your day, you go into a crisis, and you can't finish being at work, working a full shift at work because you have to leave early because you're hurting too bad. But yeah, it's hard to plan. And again, like I said, you don't always have people in your life that understand, and sometimes they make you feel like there's something wrong with you because you're the one that's challenged. But then on the flip side, you have people that overstand and they overcompensate and they overdo. So then they treat you like you're a handicap, or they treat you like you're a patient. And one thing we as sicklers do not want to do, we don't want to be treated as patients. We don't want to be treated as fragile because we go through that enough in our life. So then when you're trying to do stuff and you have a data where you really feel good and you want to test the waters and see, let me try to do as much as I can today because I don't know when I'm going to feel this good again. But you have people screaming in your ear, take it easy. You're doing too much. You need to go sit down. You just need to go sit down. Go sit down. It's like, y'all don't realize how irritating that is when you're telling me not to do, and I'm telling you that this is the only day that I feel good enough to do something. Like when you're admitted into the hospital and you're bedridden for 3 days, 5 days, 14 days, however long you're admitted, and you're stuck in bed for days because you're hurting too bad, so you can't walk. You can't even go to the bathroom. You have to use a urinal or get assistance, and you get better, and you don't leave the hospital pain free. Let's get that clear. Majority of times we don't leave pain free. We want to get better enough to just get back to our daily function. So you're in the bed for days. You get out and you go home. The last thing that you want to do is be stuck in the house, back in the bed, recuperating for more days. When you were stuck in the hospital and you have nurses that are coming in, you have techs or CNAs or patient assistants or whoever coming in doing vitals every 4 hours, which becomes very irritating because sometimes you're hurting so bad you don't get sleep. Heaven forbid you're in a hospital where you don't have a private room, so your roommate is getting on your nerves because they moaning and groaning for whatever reason. They're loud. Their guests are loud. Like I literally had one time when I was in the hospital to where the my roommate's wife had the loudest, clunkiest heels that she could possibly find. They were like hocus pocus heels, and the hospital room was wooden floor, and she would not sit down. She just kept marching back and forth, and I'm like, "Would you sit down? Just sit down, like please." And it was so irritating. And you're hurting, and you're getting heavy narcotics IV. So, but you're hurting, so you're up all night. So you're not sleeping, but you're getting narcotics that are making you tired. So then finally, when you're just so tired that you clock out at 6 o'clock in the morning because you have exhausted yourself, Now, first shift is coming in. They're bringing your food. They're doing vitals. The doctors are doing rounds. So you're not getting sleep again. It's very frustrating. And these are daily things that we go through. So I guess to answer your question more directly, all of that is some of the hardest challenges that we deal with.
Okay, yeah, that's a lot. Like, I didn't expect like so many factors could like take effect.
You don't you don't even want to get into the unfair treatments and the biases and the discrimination. That's a whole nother something else. You know, we're penalized. We have a disease that, no disrespect to anybody, I do not want to sound insensitive to those that are living with HIV or AIDS, or cancer. But those are diseases that are acquired in life, through whatever happens, whatever went down, whatever took place. Those are diseases that, for the most part, are acquired. Okay. And they are treacherous, and my heart breaks for people that deal with that. You know, in addition to that statement, our disease is transferred. We're born with it. We grow up dealing with it. This is not something that we did. This is not something that occurred. This is something that has been passed down to us. We didn't have the option to say no. We didn't have the option to do things differently and not live with this disease. This disease affected us without our permission. And so we grow up and the doctors say you're going to have pain. So these are medicines we're going to give you to control the pain. Well, depending on how bad it is, you may have to take meds ever so often. Or like me, you have to take it every day. Well, anything that you do every day, eventually you develop a tolerance for it. Well, after you develop that tolerance, after that, you're going to need something stronger because what you were on no longer works. And then you're on that for an amount of time. And then they say, well, now you've been on this for a few years, it's no longer working. So now we have to need something stronger. And then you're on that for a few years. And then when you go to the hospital, they look at you like you're crazy because your tolerance for narcotics is so high, but it's not our fault. So then they treat you like you're a drug addict. They say you're chasing, and I'm not going to be foolish to say that there's no sickle cell patient in the world that doesn't abuse the narcotics that are given. I'm pretty sure somebody may not be in the amount of pain that they're saying that they're in. It's just that happens everywhere. However, I am saying that on a larger scale, those that are abusing the narcotics, they are not found in sickle cell patients because we don't want to come to the hospital to deal with you all to begin with. We don't know if the doctors are going to treat us and take us seriously. They'll say, well, your labs are fine, so you shouldn't be hurting. But that's not always the case. And we still need the medicines to help us. You know, we don't want to have to deal with the nurses that say, I just gave you pain meds an hour ago and you're still hurting. You know, we don't want to get the feeling of you were just here, you were just discharged and you're back. We don't want to deal with that. We don't want to have to sit there and look at our clock and say, well, I can go to the ER around this time because usually these doctors work the third shift and these doctors are a little cooler. These nurses are a little cooler. So my chances of getting adequate care around this time at this hospital is a little bit better than if I go at this time when these doctors are on, you know, or if you do go to a hospital and they don't treat you properly and you're still having issues, you leave and you go to that another hospital. Well, now most of the hospitals are all synced together through what's called Epic. So then if you go to the hospital and then they pull up your record, they say, oh, well, I see that you just left this hospital and now you're here. So now they peg you as now you're jumping hospitals and you're chasing narcotics, when really that hospital didn't treat me right and I came here hoping that you would do a better job. I mean, if the one McDonald's didn't give your order right and the customer service was poor, you just go to a different McDonald's. So why am I being penalized of trying to just get adequate care? I'm not going to leave here paying free. I just want to leave here paying less than what I'm in now. So the biases, the discrimination, the funny looks, and all of that in the hospital, and the people that's supposed to help us is just as bad.
Yeah, I never realized that so much discrimination could come just by medicine itself. And it's just hard to hear that you have to deal with that like almost every day since like the day you were born. Were there any difficulties you had with the healthcare system?
Absolutely, absolutely. Um, with your insurances, you know, your insurance company gets bought out by another company, so they switch without your permission. They switch. Well, that hospital doesn't take that insurance just yet. So then you get hit with a bill and it's not your fault because they decided to switch. Or they're in transition, so they have a switch all the information over. So then you do go to the ER and then they say, well, at this point, it's showing that you don't have insurance. Well, then if you're in that transitional period and you're trying to get your prescriptions filled, you can't do anything about it. Or let's say you do have insurance, but the narcotic rules are so strict because people have abused it. So literally, if you get a 30-day supply of meds, you're not getting your refill till the 30th day of the next prescription. Well, what happens when that day is on a Saturday and your doctor's office is closed on Friday and they're not going to be able to fill the script again till Monday, and you literally have enough just to get you through that day. But if you run out and you have to go 2 days without meds, or 3 days if the offices are late and send a prescription, well, they're not going to approve you getting your meds a day early. And so now you have to go without meds for the weekend. And they're going to say, well, we're not going to give it to you early, but we don't have no problem giving it to you late. That becomes an issue. I had an issue earlier to where my doctor, my main hematologist, left the practice. Well, with your insurance, they have one doctor, one pharmacy, one prescribing provider. That's it when it comes down to narcotics, your medicines. So that doctor left the practice. Our cases were picked up by another hematologist. That hematologist was not on my insurance. The hematologist prescribing provider that's under him that writes his prescriptions was not on my insurance. They made it my responsibility to call the insurance to switch all that information over when we didn't ask you all to take our case. You all switched that. It should have been your job to say, we're acquiring these new patients. If we want to get paid, we're telling you that we are now accepting these cases under our care. But no, they made it our responsibility, which made it difficult because I had to go through this 4-day time frame of not getting my scripts. It's very cruel because, again, it says, we're not going to give it to you early, but we don't mind giving it to you late. And the sad thing about it is, again, no disrespect to anybody that deals with this, but sickle cell patients and cancer patients have the same exact doctors. We are both seen by hematologists and oncologists. However, the standard of medical care is not the same for sickle cell patients as it is for cancer patients. When a cancer patient comes into the hospital, the red carpet is rolled out for them. When a sickle cell patient comes to the ER, if they don't view it as an emergent case, you're sometimes left in the ER waiting for 3 to 6 hours. And you're watching people who have milder cases go in before you while you're waiting for a room.
Sorry to interrupt, but I also wanted to say, like, Anya and I go to like a school where they train us to be like medical professionals, and the first thing they tell us in every class is never to discriminate and always make sure that you're treating every patient with care and kindness. And I just think it's really sad that the doctors you face, the years they studied, and they still haven't learned how to treat people kindly.
Because you have to understand, it's unfair that our pain protocol is in the hands of regular hospitalists when our entire care is a specialty case. So hematologists who study sickle cell disease are only brought on as a consult. But once your hemoglobin and your reticulocyte counts and your blood level stabilize to where you're not necessarily in a hemolytic crisis, they're off the case. And the pain control is now in the care of just hospitalists, where your hospitalist is not a specialist in sickle cell disease. Their entire care and knowledge is based off of the amount of study they did in medical school when they covered that chapter. Anything other than that is, if you're lucky, you have a hospitalist that did a rotation at a sickle cell hospital, or something like that. But other than that, if they want to give you the pain meds and they want to be free with it, great. Thank God if we get those type of doctors. But if you have others that say, all right, well, we're going to switch you all to oral and then we're going to discharge you this afternoon. I'm not even ready to go home yet. Doesn't matter. Nurses come in, the doctors change your orders, they switch you to oral, and they go to discharge papers. And you're booted out. And the sad thing about it is that in the hospital, they have patient advocates and everything, but there's still nothing in place to force the doctor's hands to treat us. They'll wag their finger at them, maybe a pop on the wrist, or get their side of the story, but we're left to the prerogative of the doctors. If they want to do it, they will. If not, whatever. But we cannot file a claim to make them treat us right. But we have to deal with their decision. And their decision is law. And that's completely unfair. Especially when we show legitimate cases that we are literally in a major crisis. But according to them, they feel that you're not. Whatever.
Yeah, and I could imagine it's harder due to all the restrictions as well, like insurance as well, due to doctors discriminating, due to basically the entire system. Um, yeah, I mean, I don't even I don't even know what I would do.
It's challenging, and it was even more challenging during the pandemic. I spent my 33rd birthday this year in April in the hospital, and I was alone because you couldn't have visitors. When you're in a crisis, when you're in pain, the medicines don't help a lot. It takes a minute for it to get under control, so you're kind of just chasing it. So sometimes having a friend in there to keep your mind off of it, having a loved one to get in the bed with you and hold you because you're crying. I'm a grown 33-year-old man that sometimes screams at the top of my lungs because I'm hurting so badly. Both of my biological parents are deceased. Yeah, so like I was saying that, both my biological parents are deceased. So when you're sick, like I said, I spent my 33rd birthday in the hospital this year, and during the pandemic, you couldn't have visitors. You couldn't have anybody. I mean, thankfully, I had really great nurses that were coming in, wishing me a happy birthday, and my doctor wished me a happy birthday. But other than that, I didn't have anybody other than FaceTime and Facebook Live, but that still wasn't physical interaction. So, growing up, whenever I was hurting really bad, like I said, my mom would just hold me, and that comfort would sometimes ease the pain. Well, going into a crisis during this pandemic, you don't have that. You're by yourself. And you would be lucky and blessed if a nurse is compassionate enough to touch you and everything. But I had one doctor that didn't even want to touch me or examine me. She stayed with her gloves and her mask at the door, just like, okay, 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 this is what we're gonna do, and I'll see you tomorrow. And that was that. Because she was so fearful of the virus that she wouldn't even, like, I didn't have the virus, of course, but they were just so scared in the earlier part of the pandemic that they didn't touch you. So that could be very challenging as well. So
Yeah, I can imagine that, like, even with the pandemic, it makes everyone's life even much harder than it usually is. And the fact that you do need like your medication and everything just to stay healthy. So yeah, it tends to be a huge factor that affects you greatly.
absolutely, absolutely.
Um, do you think that greater awareness about this disease would have improved you or your loved one or your family's experience in any way?
100% yes. Sometimes when you don't know better, you don't do better. So sometimes just better care, better awareness can go a long, long way. You have some sickle cell patients that get upset with nurses or doctors who aren't really too familiar how the disease works, and they'll ask certain questions like, well, how long have you had it? Well, you're born with it, so it's not something that, oh, I just started last week. But if you don't know, you don't know. So I love it when I have nurses that aren't really too familiar and they ask me questions, and I can, enlighten them a little bit, because that means that that's another person that will hopefully treat the next sickle cell patient a little bit better, because they have a little bit more knowledge of how the disease works. And it's different in everybody. It doesn't affect everyone the same. So you have to keep that in mind as well.
Yeah, that's very, very true. How big of an impact do you think more awareness have?
Like I said, it would change a lot. I'll put it like this. We've been screaming racial injustice for a very long time. But as of recently, when it just got so big to where more and more people were affected, then you start seeing a lot more change, because more people were aware of what was happening. And now a lot more things, there's still a long way to go, but we're a lot closer than where we were a few years ago. So the more that people become aware of what's happening and what's going on, the better opportunities and greater chances that we'll have to get better treatment, to get better care, and to get, better understanding of what it is that we deal with, what we go through, and what we face every single day of our lives.
Yeah, and I think that as you raise more awareness, there tends to be more research around the whole disease, which comes like one step closer to actually finding a cure.
Exactly.
Yeah.
Exactly.
Um, that's all the questions that I have. Is there anything else that you want to add?
No, I just thank you all so much for this opportunity to share my story. I can get a little passionate when it comes down to talking about it, because we don't get to just express and vent all the time without coming off as overly emotional. So thank you for this opportunity and for being considerate enough to just bring more awareness and highlight something that affects my life every single solid day, and potentially, possibly, my future children's life as well. So thank you for that.
No, I just wanted to say like you're welcome and like thank you for like having this interview with us and answering all our questions. It was actually really like informative and like it brings like a different viewpoint as to how much sickle cell disease actually does affect one's life.